I'm Christine Campbell. I live in Belfast and I was diagnosed with stage 4B high-grade serous ovarian cancer in April 21. My diagnosis was through an emergency gynae appointment. I'd been experiencing symptoms for about 4 or 5 months. I didn't realise how serious they were, and I got a red flagged appointment to a local hospital where I was then admitted straight away through A&E into a ward in the local hospital. I was introduced to support from palliative care literally from the moment I stepped into the hospital ward. I was appointed Anna Macmillan nurse. She was my key contact within the hospital for all things concerning my treatment and my discharge and what I would need after my discharge. Palliative care really is very important to me. I was given a terminal diagnosis in July 23 of less than 12 months. That was a really traumatic time for me. It was a lot to process and I just needed support. And I wasn't sure where I would get that support from. I did have a Macmillan nurse, but also I was appointed a clinical nurse specialist in the cancer centre, who were my key contacts with regards to any needs that I needed outside my general treatment.
As part of the Cancer Survivorship Initiative, the recovery package was developed, the main focus of which was to ensure that those living with and beyond cancer get the care and support they need to lead as healthy and active a life as possible for as long as possible. Provision of holistic needs assessment is a core element to this.
Palliative care to me is looking after my needs outside a medical setting as well. It's not just medical intervention. It's about understanding what I need and when I need it.
A HNA, or Holistic Needs Assessment, is a therapeutic conversation tailored to the individual, which facilitates a comprehensive assessment of their needs, conducted between the patient and the clinical nurse specialist. This can happen at pivotal points in the patient's pathway. It aims to identify any concerns where support may be needed, and this includes physical, psychological, social, spiritual, and sexual concerns.
I've had 3 rounds of chemotherapy, and as a female, it can be quite traumatic again to lose your hair, because that is something that's really important to you. They were able to direct me to a wig specialist who created a wig that was exact replica of my hair at that particular point in time, which was great. Palliative care also means to me that I have some control back in my life, that it gives me options. I say things like the benefits advice, the wig service, also dietitians, which is really important, because when you're on steroids and different types of medication, your body does change, and it's dealing with that body image as well, and also how you can be more healthy and how you approach what time that you have left. In my case, I knew I was a bit overweight and I knew I needed to take a better care of myself and then be in a good position then to carry on my treatment, because I was in a healthier place than I was before.
Holistic needs assessment in practice is truly invaluable, and it can contribute to improved health outcomes and quality of life overall.
The thing that I wished I'd known about palliative care was it's enabled me to live my best life at this moment in time.